Heart disease is killer number one. Killer number two is cancer. 500,000 Americans are expected to die this year with cancer. That's like 5 jumbo jets crashing every day.
Meet Dr. Michael Greger, a highly respected physician, author, and speaker known for his evidence-based insights on nutrition and lifestyle medicine, dedicated to educating individuals with science-backed health information. Dr. Michael Greger has empowered millions to make informed decisions about their well-being. As the author of How Not to Die and the founder of nutritionfacts.org, he highlights the critical role of diet in preventing and even reversing chronic diseases like cancer. In today's video, we'll expose the most dangerous drink that, according to Dr. Greger, can fuel cancer growth. We'll also dive into how this beverage affects the body, increasing the likelihood of cancer and other serious diseases. And that's not all. We'll also share healthy alternative that can help you to eliminate this harmful drink from your diet, supporting longevity and overall wellness. But before we unveil the beverage to avoid, let's first understand how diet influences cancer development and why certain drinks can make the problem worse. Cancer thrives in environments of chronic inflammation, insulin resistance, and oxidative stress. Many of these conditions can be aggravated by what we consume daily. Some beverages are loaded with sugar, artificial ingredients, and unhealthy additives that not only spike blood sugar levels, but also create an acidic and inflammatory state in the body. Over time, these effects weaken the immune system and promote an environment conducive to tumor growth. Avoiding such harmful drinks is a crucial step toward reducing your cancer risk and supporting your body's natural defenses. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions about your health or medical condition. Do not disregard professional advice or delay seeking it because of something you have read here. Now that we've explored the critical role of diet, it's time to uncover the most harmful drink that fuels cancer. According to Dr. Greger, one of the most hazardous beverages associated with cancer development and progression is none other than alcohol. Cancer is a complex condition marked by uncontrolled cell growth. While genetics contribute to its onset, lifestyle choices play a crucial role in determining risk. Factors such as poor diet, smoking, physical inactivity, and alcohol consumption are among the leading causes of cancer.
Recently, the IARC, the International Agency for Research on Cancer, the official World Health Organization body that decides what is and is not cancer-causing, concluded that alcoholic beverages, all alcoholic beverages, are to be considered carcinogenic to humans.
Recently, alcohol, widely consumed in the form of beer, wine, and spirits, has been classified as a Group 1 carcinogen by the International Agency for Research on Cancer. This designation places alcohol in the same category as tobacco and asbestos due to its well-established link to cancer.
That about 5,000 breast cancer deaths a year are attributable to light drinking, meaning nearly 5,000 women that died of breast cancer maybe wouldn't have if they just would have stayed away from alcohol completely, leading to an editorial in the medical journal Breast that concluded, women who consume alcohol chronically have an increased risk for breast cancer that is dose-dependent but without threshold, meaning there's apparently no level of alcohol consumption that doesn't raise breast cancer risk at least a little. So no safe threshold. Any level of alcohol consumption appears to increase the risk of developing an alcohol-related cancer.
Research studies have confirmed the connection between alcohol consumption and several cancers, including breast, liver, colon, esophageal, and head and neck cancers. Unlike sugar, which primarily increases cancer risk through obesity, alcohol directly harms cells, making it particularly dangerous. While sugary and processed drinks pose health concerns, alcohol's carcinogenic effects are far more severe. It not only initiates cancer, but also accelerates its spread by promoting metastasis, weakening the immune system and reducing treatment effectiveness.
We've known about the possible association between the consumption of alcohol with excessive mortality from cancer for more than 100 years. Though the evidence is accumulating that alcohol drinking is also associated with pancreatic cancer, prostate cancer, and melanoma, we're pretty certain that alcohol increases risk of mouth cancer, throat cancer, esophageal cancer, colorectal cancer, liver cancer, voice box cancer, and breast cancer. Current estimates suggest that alcohol causes about 5.8% of all cancer deaths in these organs worldwide.
What in alcoholic beverages is causing all the damage? Firstly, when alcohol is consumed, the body metabolizes it primarily in the liver. During this process, ethanol is broken down into acetaldehyde, a highly reactive and toxic compound. While this metabolic step might seem routine, the consequences for cellular health are profound. Acetaldehyde doesn't just pass through the body harmlessly. It inflicts serious damage on a cellular level. It is a known carcinogen, capable of binding directly to DNA and proteins within cells. This binding process causes DNA damage and interferes with the body's ability to repair itself. The body has limited defenses against acetaldehyde exposure, especially in heavy or frequent drinkers, where the accumulation can overwhelm natural repair mechanisms. Other than acetaldehyde, alcohol contains other harmful carcinogens. Polycyclic aromatic hydrocarbons, found in some alcoholic beverages like whiskey, beer, and wine, are dangerous compounds known to cause cellular mutations. Additionally, nitrosamines, which can be present in certain alcoholic drinks and even form in the stomach, further increase cancer risk. Additionally, some individuals have a genetic variation that results in slower acetaldehyde breakdown, leading to prolonged exposure to this toxin. This genetic trait significantly raises cancer risks, particularly for esophageal and head and neck cancers. The critical danger of acetaldehyde and alcohol's other toxic byproducts is their role as cancer promoters. When DNA damage goes unchecked, it can trigger mutations that lead to uncontrolled cell growth. Scientific studies have linked exposure to these toxins lead to several cancers, including liver, breast, and colorectal cancers. Dr. Michael Greger emphasizes that avoiding alcohol or significantly reducing its consumption can drastically lower this risk, making it a key step in cancer prevention. What other factors in alcohol consumption lead to cancer? Stick with us. Before we move on, if you are looking to dive deeper into the worst drinks that feed cancer, be sure to subscribe to the Vitazen Health newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you live longer and feel your best delivered right to your inbox. Hormonal balance is essential for regulating cell growth, repair, and overall health. However, alcohol consumption can significantly disrupt this balance, particularly by increasing estrogen levels in the body. While estrogen plays a vital role in various biological functions, excessive levels can become a catalyst for cancer development. Understanding alcohol's impact on hormone regulation helps explain its strong link to hormone-related cancers, particularly breast cancer. Not only that, when alcohol is metabolized, it interferes with the liver's ability to regulate hormone levels effectively. The liver is responsible for breaking down excess estrogen, preventing it from accumulating in the bloodstream. However, alcohol impairs this function, leading to prolonged elevation of estrogen levels.
Alcohol has been shown to increase sex hormone levels like estrogen, which may increase breast cancer risk, but you see the opposite happening eating fiber-rich foods. Fiber appears to bind estrogen in the colon and help flush it out of the body.
Additionally, alcohol stimulates the activity of aromatase, an enzyme that converts androgens into estrogen. This effect further increases estrogen concentrations, particularly in women, compounding the risk of hormone-driven cancers. The most alarming consequence of alcohol-induced hormonal disruption is its strong connection to breast cancer. Elevated estrogen levels are directly linked to hormone receptor-positive breast cancers, the most common subtype. research indicates that even moderate alcohol consumption can elevate estrogen levels enough to influence cancer risk. Dr. Michael Greger highlights alcohol's role in hormonal imbalance as yet another compelling reason to avoid it. By eliminating or reducing alcohol intake, individuals can help restore hormonal balance and significantly lower their risk of cancer. Inflammation and oxidative stress are essential biological processes that aid in healing and cellular repair when properly regulated. However, when they become chronic and excessive, they contribute to the development of various diseases, including cancer. Alcohol consumption disrupts this delicate balance, fueling persistent inflammation and oxidative damage, which creates an environment conducive to cancer growth. As alcohol produces acetaldehyde, a toxic compound that generates free radicals, unstable molecules that inflict damage on cells. This leads to oxidative stress, a state where the body's antioxidant defenses are overwhelmed, allowing these reactive molecules to attack cellular components like DNA, proteins, and lipids. The result is genetic mutations and widespread cellular dysfunction. At the same time, alcohol irritates tissues, particularly in the liver, digestive tract, and oral cavity, triggering chronic inflammation. This prolonged inflammatory response prompts the immune system to attempt constant repairs, often leading to scar tissue formation and abnormal cell growth. The combination of oxidative stress and chronic inflammation makes alcohol a significant cancer promoter. Together, they create a cellular environment where damage accumulates faster than the body can repair it, increasing the risk of cancerous mutations. Scientific research has linked this inflammatory response to cancers of the liver, esophagus, colon, and pancreas. Dr. Michael Greger highlights that alcohol-driven inflammation and oxidative stress are critical mechanisms in cancer development, emphasizing the importance of avoiding alcohol to protect cellular health. And there is no safe limit. Even minimal alcohol consumption carries substantial cancer risks. Dr. Greger's research strongly supports total abstinence as the best way to reduce cancer susceptibility. He challenges the misconceptions surrounding the supposed benefits of moderate drinking and emphasizes the crucial role of a plant-based diet in cancer prevention.
The World Health Organization, the World Heart Federation, Global Burden of Disease Study, etc., say the only safe level of drinking is none.
Organizations like the World Health Organization and the Centers for Disease Control and Prevention recommend limiting alcohol consumption or abstaining entirely. No level of alcohol consumption has been deemed completely safe for cancer prevention. So, do you still think red wine is healthy for your heart due to its antioxidants? Well, the carcinogenic effects of alcohol outweigh these minor benefits, and these benefits can also be taken from non-alcoholic sources.
If you eat some cheese and crackers, this is the triglycerides bump you get. If you sip some wine with the same snack, they shoot through the roof. Now, we know it was the alcohol because if you use de-alcoholized red wine, non-alcoholic red wine, the same wine but with the alcohol removed, you don't get the same reaction. This has been shown in about a half dozen other studies, along with an increase in inflammatory markers. So,
hold up. Did you know inflammation is one of the biggest causes of cancer, heart disease, and aging? And most people are making it worse with what they eat. That's why I put together the Anti-Inflammation and Immunity Smoothie and Juice Guide, 80-plus science-backed recipes designed to stop inflammation, boost immunity, and help your body heal. Grab your copy now from the video description below. Reducing alcohol intake is a powerful step toward better health and cancer prevention. While many people understand the risks, breaking the habit can be challenging due to social norms, habits, and even mild dependency. Cutting back on alcohol requires both mindset shifts and practical strategies, making it essential to explore effective ways to support this lifestyle change.
Now, eating a healthy diet may help modulate that risk. Yeah, alcohol increases the risk of breast cancer, but a fiber-rich diet may have the opposite effect. And so eating more whole plant foods may be able to help ease the adverse effects of alcohol.
One of the most effective ways to cut down on alcohol is to explore enjoyable non-alcoholic alternatives. Drinks like flavored sparkling water, herbal teas, or alcohol-free beers and wines can help you move along your social circle without any health risks.
In addition to water, green tea, probably one of the healthiest beverages we can drink, been associated with 30% reduction in breast cancer risk and may protect against gynecological malignancies like ovarian cancer and endometrial cancer, as well as lower our cholesterol, blood pressure, blood sugar, and body fat. Third healthiest beverage may be hibiscus tea.
Moreover, seeking support from health professionals, such as nutritionists, therapists, or support groups, can also provide guidance and accountability during the transition. Professional help is particularly important for those with a history of heavy drinking. Social settings often revolve around alcohol, making it difficult to abstain without feeling left out. However, actively engaging in alcohol-free social activities like coffee meetups, fitness classes, or creative workshops can help build a supportive environment. By incorporating these strategies, individuals can significantly reduce their alcohol intake, leading to better overall health and a lower cancer risk. Dr. Michael Greger emphasizes that cutting back on alcohol isn't just a lifestyle choice, but a crucial step toward disease prevention. Putting an end to alcohol consumption allows individuals to safeguard their health and longevity. So, that is all for the worst drink that feeds cancer cells. However, even with the right dietary changes, an overlooked factor could still be fueling cancer growth: exposure to environmental toxins or maybe chronic bad habits. So, join us in the next video to identify 5 devastating habits that can secretly fuel cancer growth in your body.